So hi, my name is Hannah. I am the program manager for Tobacco-Free Adagio Health. I have some of my team members here. I have Stephanie and Grant Young here with us. We're going to be discussing nicotine, tobacco, vaping, all of these hot topic issues, some things that are affecting students and families right now. So today we're going to talk about some current statistics around vaping. It's affecting a lot more of us than we're probably aware of. We're going to get into some of the devices, what we're seeing students using, what we're seeing being really effective kind of treatment measures, and then getting into our devices, about where they're being hidden and concealed, some things for parents to look for, talking about the connection between the pandemic and vaping. There's a lot of health concerns that have very similar effects related to both. And then we're going to get into our prevention, education, intervention services, and really talk about how we can, help students who are vaping, who might have a nicotine addiction, and give them some resources to be able to help. So Tobacco-Free Adagio Health is a nonprofit organization in the Pittsburgh area, serving these counties that are highlighted in blue on this map up here, as well as Allegheny County and the city of Pittsburgh. Our main goals are to prevent and reduce tobacco, nicotine, vaping use, educate individuals on tobacco hazards, the dangers of second and third-hand smoke, and facilitate youth programming for students of all ages. Another unique aspect of our work is our technical assistance that we provide for tobacco-free policies. So for any type of multi-unit housing building, work site, school district, any place where people are living, working, or playing, we're trying to make those tobacco-free spaces. So we help out with passing policies, making sure that those areas are staying as safe as possible. Getting into a little bit of the statistics, what's happening, what we're seeing with youth. About 28% of youth are everyday e-cigarette or vaping device users. That number is going up each year. More than 4 in 10 youth have reported using a device at least 20 of the last 30 days. So most of the last month, at least 40% of our students are using them that regularly. Tobacco is actually the second most used drug among students in Pennsylvania, following marijuana, which probably isn't surprising, but they are very close in the amount of usage per student. If we are kind of looking at where this survey came from, these results might be even underrepresented because it was a self-report study. Students might not have been reporting on the actual amount of usage. So e-cigarettes are the most used tobacco product in the last 9 years. So we're seeing people reach for them more than traditional cigarettes, more than smokeless tobacco. They are the most accessible and easy to use. The brand, the Puff Bar, which is actually shown in the photos up here, this is the most purchased brand of e-cigarette. About 15% of students have reported that this is the brand that they're reaching for, that they're using, and we will talk about why in a couple minutes here. This goes along with the trend of flavored e-cigarettes. So all of these Puff Bar devices are flavored. The trend of using flavored devices continues to increase and continues to affect students at younger ages. 85% of high school youth and about 82% of middle school students report using flavors of these devices over traditional tobacco or cigarettes. So we're really seeing a use in those flavored devices and having them be kind of the gateway as to students using other forms of tobacco products. Getting more into youth nicotine use, obviously vaping is the main way that youth are consuming nicotine, but students are also using a product called nicotine pouches. We saw these a lot during the pandemic because they were super easy to conceal when students were required to wear masks in school. These products are flavorless, odorless. They sit in the lip and they absorb nicotine throughout the bloodstream. So again, we saw students reaching for these as well as vaping devices, especially during the pandemic. When we get into talking about nicotine use and the developing brain, it's really important to know that young people are at most risk for developing a nicotine addiction since their brains are still developing until they're 25 years old. The younger that a student is starting to use a nicotine or tobacco product, the greater risk that they have to become addicted to that product. So if we look at this photo up here, this kind of details the reward pathway in the brain. Nicotine is delivered by smoking or inhaling on a device. It travels to the brain. Once it gets to the brain, it activates receptors that release dopamine. Dopamine is the chemical that makes the individual feel rewarded, feel calm, like they've, satisfied a craving, they've done something good for themselves. Those levels get really high as soon as nicotine enters the system, and then about 10 to 20 minutes later, they drop off dramatically, leading to withdrawal symptoms. So withdrawal looks like, headaches, anxiety, kind of irritable mood, any type of behavior a student would be, exhibiting that could kind of lead to that they are needing something. Those withdrawal triggers get so strong that they, trigger the desire for another hit of their vape, another cigarette, whatever the person is using. Those triggers start to overcome their ability to make clear decisions in the moment. So we really like to, emphasize that nicotine is a very addictive chemical. It is one of the most addictive chemicals, and especially when students start using it at a very young age. Getting into the generations of vaping devices, this is a very interesting kind of picture to look at. The vaping devices started to be available on the market in the early 2000s. This wasn't ever something that was available until about the year 2000, and they've come a really long way to 2023. So on the market now, we see these disposable flavored devices. They were originally marketed as a way to quit cigarettes. We know that that's not true, but now we're seeing the younger generation students reaching for those flavored devices because they just don't have the information about how damaging and how addictive they can be for their bodies. Getting into some of the health concerns associated with vaping, we're going to start off with the most severe health concern, popcorn lung. This is something that's been really popular in the news over the last couple years. Popcorn lung has to do with scarring of the tiny air sacs in your lungs. This is caused by a chemical called diacetyl. Diacetyl is the same chemical that was found in popcorn distribution. So when factory workers would be working in popcorn factories, the flavoring from the chemical diacetyl actually caused them to have very similar symptoms and effects that we're seeing students come in that have been vaping flavored products. So the chemical is linked to people who worked in popcorn factories who were exposed to the chemical diacetyl over a long period of time. What's unique here is that this is a very serious, severe, irreversible condition. The only cure at the moment is a lung transplant, and this is starting to affect kids younger and younger each year. So there's a lot of studies out right now seeing kids that are about 12 and 13 being most affected by popcorn lung, which is pretty serious, something that students should be aware of. Another health concern related to vaping is called EVALI. It stands for e-cig and vaping associated lung injury. This is the chronic respiratory symptoms, so cough, shortness of breath, chest pains, any type of respiratory issues that you would expect for somebody who is inhaling something other than oxygen. So when we look at these photos here, the first photo shows a picture of some clear lungs. This person is probably taking a deep breath of oxygen, doesn't have many obstructions going on. But when we look over at the other photo, it's pretty cloudy. This person has some inflammation in their lungs. This is somebody who's in the early stages of the condition EVALI. When I talk to students, I always mention that this is somebody who's not probably an athlete anymore, somebody who gets winded when they're walking up the stairs, who has difficulty doing daily tasks because of their body's low capacity to transport oxygen to their body. So it becomes very realistic when you see it in a photo here. This is the progression over just a couple months. So vaping consistently can lead to these obstructions in a very short period of time. So when we talk about the concealment of devices, this is something that we are doing a lot of research in, something that is, being coming to light in the most recent years. We have some photos up here showing, how students are concealing these devices. So to parents and to teachers and administration, a lot of these objects look just like kind of day-to-day, things that students would be having in school, nothing that would be so eye-grabbing or catching your attention to need to stop to a student and talk to them. But if we look at the photo, especially of the inhaler over here, the blue inhaler is an actual, prescribed medication. The black one is a vaping device that somebody would just be able to inhale in school without much question. Same with the smartwatch down there. Looks very similar to an Apple Watch. However, it is also used as a vaping device, something also to be aware of. Moving on, just some other photos here. There's actually online retailers that sell vaping branded apparel, kind of normalizing the term vaping, making it, something that's visible, seen every day. Students are actually wearing it on their body to kind of promote it without even realizing it. Students are hiding vaping devices, in toilet paper rolls in school, talking to their friends, knowing, where to get it, detailing exactly where it is so that other friends can come in and use it. Same with scrunchies, very easy to get into school to make sure that, they're able to have it on their body at all times because it is so addictive. So these are just some other examples of places that they're concealed and where they can be found that you wouldn't expect. So in this photo here, there are actually 6 vaping devices that can be found. So it looks just like a typical teenage bedroom, but when we look a little bit closer, there are 6 of these devices found in that photo. So there is a disposable pen. So this is your typical e-cigarette. Students would refer to them as, vape pens, something of that sort. It comes with a rechargeable piece that would plug into a USB port. Looks very similar to a regular pen. The next one we have up here is the box mod. So this is a bigger vaping device paired with the juice that would fill up that device that a student would inhale. Also in that photo, there was a cigar, and same down here with the Juul and the Juul pod. So these devices are the ones that we're seeing students use often, but not as often as those disposable devices. All of these devices are rechargeable, and they come, with certain accessories needed to allow them to work. So we have chargers, we have pods with the e-juice or the nicotine concentration in there, and they were all seen back in this photo, which, does look like a typical bedroom or something, nothing looks out of the ordinary there. So when we talk about the impact of students who have contracted COVID-19 and who are current vape users, vaping can actually speed up the spread of the disease. If students are sharing devices, it can quickly spread the infection and the disease to other individuals. It can also live on surfaces and mostly be spread through saliva. So that was a huge concern, that students were kind of spreading the disease based on the sharing of vaping devices in school. And it can also increase the likelihood of serious complications. So students who are vaping, they are at an increased risk to have developed EVALI, to develop popcorn lung, and to have worse symptoms of COVID if contracted. If their overall lung health is already compromised, they might experience more difficulty with those symptoms than an average student would. Vaping also has a huge connection to teen and youth mental health. Vaping is often, used as a coping mechanism. So about 80% of students reported that hitting their vape or inhaling nicotine or tobacco was related to decreasing their stress or anxiety. This is actually super backwards because nicotine is a stimulant and it increases, thoughts of anxiety, and it increases some of those other links between depression and stress and all of those things. Students have mentioned that they mostly use e-cigarettes or vaping devices for a form of relaxation or stress relief. We know that it is, used as something that could kind of be a crutch, as a coping mechanism, rather than dealing with the root of a lot of their actual issues. 44% of students agreed that vaping can worsen their anxiety and irritability. So we have some of that, knowledge and the information there, but most students are still saying that it is something that kind of decreases their stress. That shows us that there's a lot of work to do there. There's a lot of education for students that needs to be done to kind of uncover the truth behind, nicotine as a stimulant and all of those things. All right, so studies have also shown that there's a link between vaping nicotine and worsening symptoms of depression and anxiety, like I mentioned. Same with conditions like ADHD. So since nicotine is a stimulant, it can interact with medications used for ADHD, and it can also worsen some of those daily symptoms that students might have to deal with an ADHD or other sort of attention disorder diagnosis. So I'm going to hand it off now to Stephanie to kind of talk about our school programming. Stephanie is our youth services coordinator, so she works with students daily in intervention settings and education settings, as well as the advocacy setting that she's going to talk about. So I'm going to hand it over to her to go through our school programming options and what we offer to schools.
Hi, okay, so I'm going to, as Hannah said, get into our programming. So if your child comes home from school and they say, oh, today we learned about vaping, this is what they saw. So for our middle and high schoolers, we have a vaping presentation where we go over the difference between nicotine and tobacco. The students can learn the effects that nicotine has on their developing brains. We get into the chemicals that are in cigarettes and in vapes. We talk about the health concerns. They see some of the same slides that you just saw about the popcorn lung, the EVALI, and then we really get into how big tobacco targets youth. That's a very big part of our presentation and our programming. So the next part of our programming that we offer is Catch My Breath. Catch is an evidence-based vaping presentation program. It's free of cost to the schools, and it's for students who are in grades 5 through 12. It offers 4 30-minute sessions that goes over different parts of the curriculum related to vaping and the concerns. And then school staff and teachers, they can be trained and to facilitate this program as well. Another big piece of our part at Tobacco Free Adagio Health is in depth. It stands for Intervention for Nicotine Dependence, Education, Prevention, Tobacco, and Health. It is a mouthful, but this is our alternative to suspension. So if the students get caught vaping in school, rather than facing a fine or an out-of-school suspension where they might be penalized if they're on the sports team, we have this great program through the American Lung Association. It breaks down into 4 sessions, and they're 50 minutes each, where they get to know the facts about what the health concerns are associated with vaping, the chemicals that are inside of these products. In session 2, we go over the addiction to nicotine and the dependence. In session 3, we talk about alternatives to vaping, and we help the students build quit kits, just different activities that we would give to our adults who we help stop smoking. For session 4, we go over past, present, and future self, so what our lives would look like if we continued to vape versus if we stopped vaping. So typically this is 4 sessions. We can accommodate the schools, so if it works better to go in one day and do sessions 1 and 2, and then the next day sessions 3 and 4. So we like to do this in groups or individual one-on-one. It just depends on how many students are caught vaping. And as Grant will get into here in a little bit, this can be written into the school's policy as an alternative to suspension. So the next American Lung Association piece that we provide is NOT. It stands for Not on Tobacco. So this is a voluntary cessation-based program. So it's 10 sessions with 50 minutes each. You really get into different ways to deal with stress and to safely overcome your nicotine addiction. This is also in a small group or individual setting, and we like to refer students who successfully completed the in-depth program to the NOT, so they have the tools and the steps they need to carry on their nicotine and tobacco-free lives. So something that's very near and dear to us is TRUE. It stands for the Tobacco Resistance Unit. TRUE is Pennsylvania's youth initiative to help promote tobacco-free life, communities, and schools. It's for students who are 12 to 18. They can join a TRUE group to really prevent tobacco use through education, advocacy, and community outreach. It pairs really well with existing SAG groups at schools. They do a lot of great activities inside of the school. During lunch, you could do what's called a TRUE Storm. It's an assembly to really raise awareness about tobacco. We get to go to a youth conference, which we'll get into here in a little bit. This just shows some of the schools in the area who have existing TRUE groups. We have a number of students in the area who really do enjoy partaking in TRUE, so hopefully we can add your school to this list as well. One of the benefits about TRUE is that it really develops leadership skills for students. It looks great on a resume. There's a chance for a scholarship, so right now about 150 youth from southwestern Pennsylvania and Allegheny counties are planning to join the TRUE Leadership Conference coming up in March. This is our flyer from last year where we had guest speakers come in and discuss their experiences with substance abuse disorder and the legal system. The students were also able to train on public speaking, and they could connect with legislators because being a member of TRUE, you get to work directly with elected officials to discuss tobacco policies. So this leadership conference primed the students to be able to go to what's called Day at the Capitol in Harrisburg, where they were able to speak with more elected officials about tobacco legislation. So as I mentioned earlier, the word TRUE Storm, here are some pictures from previous TRUE Storms. It comes with a lot of what we call TRUE swag, so they'll get cool sweatshirts and t-shirts, different bags. It's a really fun way to celebrate being tobacco-free. So some of our previous events was Strike Out Vaping Day. The TRUE groups were able to come to a Pirates game, and this year we're going to continue that as well. It's a great way for the students to just get to connect and meet other TRUE groups who maybe they don't know from their own school, as well as TRUE Friendsgiving. We just did this the past November. It was a super fun way for the students to come together and connect, but they were able to relax and kind of have fun with everything. So we did fall-themed games, there were bonfires, but as well as networking games, some tobacco trivia, and then we celebrated with a Thanksgiving meal. So these are the kinds of activities that you get to do as a TRUE group member. We like to plan the TRUE programming around tobacco-free holidays. So the pictures that you see up here, the blue is a mummy from Red Ribbon Week. The theme was Arlington students don't get wrapped up in drugs. So they were able to sign their name to be tobacco, nicotine, and drug-free and place it on the mummy. And then down below we see Steel Valley TRUE students handing out for Through with Chew Week. So that's coming up in February to celebrate the awareness around being smokeless tobacco free. Some of the next ones come up in March with Take Down Tobacco Day, and in May for World No Tobacco Day. So these holidays are a great time to plan TRUE Storms, to really have us come in to do our programming in the classroom and really spread awareness about being tobacco free. So another thing we promote is My Life, My Quit. This is the Teen Quit line. It's free, it's confidential. Students can text this 855 number or go online, whatever works best for them. More cessation efforts are offered in a texting service for youth. There are a number of apps that students can use as well, but this is what we like to promote. And we brought some signage to hand out here at the school, and we can bring them as often as needed. So next up is the school policy. So I would like to introduce our policy coordinator, Grant Young, to introduce that to you.
Thank you very much. Thank you. So tobacco-free school policies, every school is required to have a tobacco policy on the books, and a lot of times they're signed in 2014, 2015, 2016, and they frequently need to be updated to keep up with the times. Our goal is to help schools move away from the punitive fines and suspensions model, where students who are caught with a vaping device or tobacco product are kicked out of school for a couple days in out of school suspension and fined $50 and sent to the Smokeless Saturdays program. And the we want to change that from the more that punitive piece to more of a restorative piece, where students are given the opportunity to address the triggers that cause them to reach for the vaping device or the tobacco product. Current policies leave students subject to prosecution by the district, and it doesn't help. And students will often be sent back to Smokeless Saturday programs for repeat offenses. Our new perspective, our new ideas, we want to make sure that the definitions are updated to ensure that all of the current tobacco products and devices are included as part of the conversation as what's prohibited explicitly. We want to include those proven interventions that Stephanie and Hannah spoke about earlier, to include in-depth as part of the consequence for reaching for the vape product and getting caught. And our goal is to keep kids in school. I think after 2.5, 3 years of COVID, we all recognize the importance of keeping kids in school. So our policies focus on in-school suspension opportunities to engage with tobacco treatment specialists and our team to or train facilitators in depth and not in order to more appropriately address the stress that they're facing in their lives. So what I do, one of my primary roles is to provide that technical assistance to school districts, superintendents, principals, counselors, whoever whoever's in the know in the building, to provide that assistance in reviewing the current policies, drafting new policy, and including the information that we've talked about so far. We also offer free educational opportunities and presentations to inform teachers, staff, students, and parents about the dangers of vaping and nicotine. And we facilitate the in-depth and the not programming, and we train staff, and we help staff members at the school get trained to facilitate it, so that if we can't be if we're double booked, we can't be here, somebody at the school can address the issue there. And do you want to take over the Parents' Call to Action?
All right, so just to wrap up, for our parents, we call them to advocate for TRUE groups to be started at school. TRUE being the advocacy initiative. It teaches leadership skills. It develops students that care about important things in the world. We ask parents to advocate for TRUE groups to be started with your child's school. We also advocate for parents to, advocate for the importance of policy change around vaping devices, talking to your child about the importance of the chemicals that are in vaping devices, and talking to, school administration about the importance of making sure that students aren't using them in school, as well as the importance for prevention starting in elementary school. We know that prevention has a lot more benefits for students rather than intervention. We want to make sure students don't need interventions. We want to kind of get them while they are able to understand and kind of make those good decisions with prevention efforts and activities before they actually need us to step in and offer intervention services. So with that, I would just like to thank you for being here. Thank you for listening to, kind of all we have going on. We're passionate about making sure the next generation is not harming themselves with vaping devices and is informed about the way to make good, healthy decisions for their bodies. So at this time, I would just like to say thank you. This is our contact information if you need to get in touch with us. Very simple email address, tfah@adagiohealth.org, and there is a link to our website as well. So thank you so much. We are here for any questions.